Welcome back to Pill to Purpose. Today, we're diving deep into a medication many of you might have heard of, amlodipine, one of the most commonly prescribed medicines for managing high blood pressure and certain types of chest pain. In this video, we'll break down exactly how amlodipine works, explore its benefits, discuss potential side effects, and share crucial safety tips to help you use it effectively. By the end, you'll have a clear understanding of this important medication. Let's get started. So, what exactly is amlodipine? In simple terms, amlodipine belongs to a class of drugs called calcium channel blockers. Now, that might sound a bit technical, but the core idea is pretty straightforward. Think of your blood vessels as flexible pipes. When these pipes are narrow or constricted, it's harder for blood to flow through them, which increases the pressure against their walls. This is what we call high blood pressure. Amlodipine works by relaxing and widening these blood vessels, allowing blood to flow more freely and easily. This simple action is the key to its powerful effects on your cardiovascular system. Let's look a little closer at how it achieves this. The muscle cells in the walls of your heart and blood vessels need calcium to contract or tighten up. Amlodipine acts like a gatekeeper. It selectively blocks calcium from entering these specific muscle cells. When less calcium gets in, a few important things happen. First, the smooth muscle in your blood vessel walls relaxes, causing the vessels to widen. This directly lowers your blood pressure. Second, by relaxing the arteries that supply blood to your heart, amlodipine allows more oxygen-rich blood to reach the heart muscle. This is particularly helpful for people experiencing chest pain or angina, which often occurs when the heart isn't getting enough oxygen. So, it's a dual-action mechanism, lowering pressure and improving heart oxygenation. Given how it works, what do doctors actually prescribe amlodipine for? Its two primary uses are for treating high blood pressure, also known as hypertension, and for managing certain types of chest pain, specifically angina. It's also used in cases of coronary artery disease to improve blood flow to the heart. The medical benefits are significant. By effectively lowering blood pressure, amlodipine plays a crucial role in reducing the long-term risk of serious health events like stroke and heart attack. For those with angina, it can significantly improve quality of life by relieving chest pain and increasing their capacity for physical activity. Essentially, it helps protect your heart and brain from the damaging effects of high blood pressure and poor circulation. Now, let's talk about side effects. Like any medication, amlodipine can cause side effects, but it's important to know that most people tolerate it very well. The most common side effects are typically mild and often improve or disappear as your body gets used to the medicine. You might notice some swelling in your lower legs or feet, which is known as edema. This happens because the widened blood vessels can sometimes leak a bit of fluid into the surrounding tissues. Other common effects include headaches, a feeling of warmth or flushing in the face, dizziness, and feeling unusually tired. These are generally not a cause for major concern, but it's always a good idea to mention them to your doctor during your next visit. While common side effects are usually manageable, there are some serious side effects that require immediate medical attention. If you experience severe swelling of your hands, ankles, or feet that is either sudden or very uncomfortable, you need to contact your doctor right away. Another serious sign is feeling extremely dizzy or lightheaded to the point of fainting, which could indicate that your blood pressure has dropped too low. If you retaking amlodipine for angina and your chest pain gets worse or more frequent after starting the medication, this is a red flag. An irregular or very fast heartbeat is also a reason to seek immediate help. Finally, like with any drug, an allergic reaction is possible. Signs include swelling of the face, lips, or tongue, or difficulty breathing. If any of these occur, it's an emergency. So, who should be cautious with amlodipine? This medication isn't suitable for everyone. It should be avoided or used with extreme caution if you already have very low blood pressure. Since amlodipine lowers blood pressure further, taking it could be dangerous. People with a severe narrowing of the heart valve, a condition known as aortic stenosis, should also avoid it, as it can worsen their condition. Of course, if you have a known allergy to amlodipine or any of its ingredients, you should not take it. It's also crucial to tell your doctor about all other medications you are taking, especially certain heart medicines, as they can interact with amlodipine. The most important rule is to never start or stop taking amlodipine without consulting your doctor. They will determine if it's the right and safe choice for you. To get the most benefit from amlodipine and minimize risks, following a few safety tips is key. First, consistency is everything. Take your dose once a day at the same time each day. This helps maintain a stable level of the medicine in your body. A very important rule is to never stop taking it suddenly, especially if you're using it for chest pain. Doing so can cause a rebound effect and make your angina worse. When you're first starting the medication, you might feel dizzy. To prevent falls, rise slowly when you get up from a sitting or lying position. Your lifestyle choices also matter. Reducing your salt intake can work hand in hand with amlodipine to achieve better blood pressure control. You should also monitor your blood pressure regularly at home to see how well the treatment is working. Lastly, it's best to avoid or limit alcohol, as it can increase the dizziness caused by the medication. That brings us to the end of our deep dive into amlodipine. As we've seen, it's a highly effective medication for controlling high blood pressure and preventing heart-related chest pain. But like any powerful tool, it works best when it's used correctly and under the guidance of a healthcare professional. Understanding how it works, what to watch for, and how to take it safely empowers you to be an active partner in your own health journey. We hope this explanation was clear and helpful. If you found this video useful, please give it a thumbs up. And don't forget to share it with anyone who might benefit from this information. For more easy-to-understand medical explanations, make sure to subscribe to Pill to Purpose and hit that notification bell so you never miss an update. Your support helps us create more content just like this. Thank you so much for watching, and we'll see you in the next video. Stay healthy.